Okay, students, with week two, let's go ahead and talk about your two assignments that are due. And these really are very easy. Basically, they're making you do some critical thinking, which you're all able to do. So let's go ahead, preventing claims denial. So what is denial of a claim? This is the refusal of an insurance company or carrier to honor a request by an individual or his or her provider to pay for health services obtained from a healthcare professional. Okay, so let's just say that you are not feeling well. Your heart is, you just feel like your heart is out of rhythm, palpitations, that type of thing. So you go to the doctor. The physician sees you, and let's say they decide we're going to just do a simple EKG. I guess they're never simple. And you're going to have a couple of different charges here, one for the office visit, you saw the physician, and one for the EKG. And then you're going to have diagnosis codes put with those charges. Okay. So what I'm looking at here, if you look here, here's some articles on how to prevent this. So let's just talk about how this apparently you going in and being seen because you feel like you have some heart palpitations, they do an EKG. Let's say they submit them both, they have diagnosis on both, and the insurance company says that we do not pay for an EKG on a patient under 40. Okay, that's a denial of claim. Or let's say the denial of claim could be we don't pay for patients to have a office visit, plus a procedure done at the same time. That would be a denial of claim. Okay. So anything that gets sent to your insurance company that they're going to deny by your provider. So what we're looking at here, by looking at all these different articles, these are great articles. Denial prevention, understanding common culprits and how to avoid them. So why is this topic of concern in the healthcare industry? So you're going to read this. Why is it really important, that we don't have so many claim denials? Why is this such an important topic? Okay, let's just think of that. Every time an insurance company denies a claim, it goes back to the physician office, which is manpower, time it takes for somebody to evaluate it, possibly the physician to evaluate it again. So it's taken up their time too. So these are different things. So, and then I want you to look here. After reading through these articles, what are the four most common strategies recommended by these articles? What are they telling you to do that's going to help you not get these claims denied? Maybe making sure that the insurance covers up, different things like that. So, what strategies, which I'm sure everything's going to be new to you, okay? But you may find some interesting things here that you're like, wow, this is something that is a shocker I really didn't know about. And then what strategy do you think should research further? And why? As a medical assistant, you know, why should I research this further? So hopefully, like this, it's not going to be a cut and dry assignment. You're going to have to put some thought in it and do some critical thinking. All right, so collection strategies. So with collection strategies, keep in mind collection. This is what happens. So let's say you are working an office for a physician and you sent out the bills, okay? And patient A has not paid their bill, and you next month send the bill again. And patient A has not paid their bill for the second month in a row. Let's say it's $60. So you send them a letter saying, you know what, if you don't pay your bill, in the next 30 days, we're going to send you over to collections. One thing to remember, sending somebody over for collections, um, they only get a portion of that money once you send them to collections. So physician offices don't like to do that, but sometimes they don't have any other choice. Okay, so basically here you want to look at, we have 4 strategies for providers to collect on outstanding balance. Okay, how can they do it before they have to send it to a collection agency? And then sometimes compassionate healthcare collection strategies for physicians. What if they're really down on their luck, they can't pay it? Are you able to set that physician office able to set up a payment plan? Key ways to boost point of service patient collections, 6 strategies for better billing and collections. So this just talks about how you can collect an overdue bill from a patient without possibly sending them to collections, right? So why is this topic a concern to the healthcare industry? Once again, you're just going to do some critical thinking. You're going to review these articles and give me your thoughts on this. What has changed for many patients over the past 5, 10 years? Okay, what has changed for patients? You know, do they not have insurance? That could be one of them. Do they have less money? Something going on with COVID? Okay. What are the 4 most common collection strategies recommended by these articles? And what strategies are new or interesting to you? What do you think you should further research? So once again, these assignments are not cut and dry. There's some critical thinking going on. So take your time, be in a place where you can think, read these articles, and take notes while you're reading the articles. That'll help a lot. So take some notes while you're reading the articles, that, put some things down, and best of luck. If there's any more questions, please let me know.